from Saginaw Valley State University. I'll be your student nurse today. Can I get your name and date of birth?
Yeah, it's Emily Crandall and 04-1604.
Alrighty. Do you have any allergies?
No.
Do you know where we are?
Yeah, in Saginaw, Michigan.
Do you know the president?
Yes, President Biden.
Do you know what year it is?
2024.
Alright, you are learning oriented times 3 and I feel comfortable proceeding with our assessment. We're going to be just doing a head-to-toe assessment, basically going through your different body systems and checking for functioning and making sure there's no issues.
Okay.
I'm just going to start with a brief medical history, just asking some questions, just answer them to the best of your ability.
Okay.
Do you take any daily medication?
No.
Do you take any like herbal supplements or vitamins?
No.
No? Okay. Do you have any hospital stays or past diagnoses I should know about?
No.
Any surgeries?
No.
No. Do you have any family history you're concerned about? Any like hypertension, diabetes?
No.
No. Do you drink at all? Any alcohol?
No.
Do you smoke anything? Maybe like cigarettes or nicotine?
Nope.
No? Alright, what's your diet look like?
It's pretty balanced. Fruits and vegetables, proteins.
Okay, so it sounds like you're getting enough macros in throughout the week.
Mm.
Alrighty. What's your exercise look like weekly?
It's about 6 to 7 times a week.
Okay, and doing what? Just like walking, lifting?
Yep, a variety of things.
Oh, perfect. So you have no issues with your mobility.
Mm-mm.
Alrighty. Are you in any kind of pain today?
Nope.
No. Do you have any continence issues? Maybe like wetting the bed at night?
Nope.
No? Alrighty. So now I'm going to continue with just getting some vital signs. I'm going to get your blood pressure on your left arm. Let me pull your sleeve up. Feet are uncrossed. I'm going to be using the diaphragm of my stethoscope to listen to our blood pressure. I got a blood pressure of 112/70. That's within normal limits. You want to be somewhere around 120/80, preferably below. But I'm not concerned about any hyper or hypotension. Next, I'm gonna get your radial pulse. I'm just gonna feel for your heartbeat. Okay, your radial pulse was about 70 beats per minute. Next I'm going to feel for symmetry. You feel nice and symmetrical. I'm going to feel your brachial pulses for symmetry. Those feel nice and symmetrical. Next I'm just going to look at your hands. I'm looking for any clubbing. Clubbing would mean that you had depletion of oxygen and then your capillary refill is under 3 seconds, so you're getting enough perfusion of blood. So no concerns there. If I had a thermometer, I would get your temperature, but I don't, so I would assume your temperature would be 98.6%, not percent, degrees Fahrenheit. I'm gonna feel it for your temperature. Your face feels good. Have you had any fevers lately?
Mm-hmm.
No? Okay. If I had a pulse ox, I would put that on your finger, but I don't, and I would assume your oxygen percentage to be 95 to 100% room air. So no concerns with that. And then I would also use a Snellen test with like the E's or letters and check your eyesight, and that would be testing cranial nerve number 12, but I don't have that with me. So next I'm going to move on to your arms. I'm just inspecting your arms, Looking at them, looking at your color, so you have freckles on them. Just looking to see if anything abnormal. Your temperature feels good. I'm just looking to see if you had like maybe some moles that we would be concerned about. When I see you have a tattoo, did you have any issues with that healing process?
Mm-mm.
Your arms look good. I'm gonna feel for symmetry. Your muscles feel nice and symmetrical, so no concerns there. Can you squeeze my fingers for me? Can you pull me? Can you push me? Can you push up? Can you push down? Push in? Can you push out? Perfect. Your grip strength on your arms and range of motion seem to be working well. Next, I'm going to put my hands on your shoulders and I'm just going to have you shrug. Perfect. And then next, I'm going to have you do some swimming arms. Perfect. So your arm range of motion is good, and then the shrugging was testing your cranial nerve number 11, which seems to be intact. So now that I've done your arms, I'm going to have you do some okay signs. And then you go as fast as you can. Perfect. Put your hand on your left and have you flip it over and then flip as fast as you can. Perfect. That was testing your cerebellum function, which seems to be working. Next, I'm going to move on to your face. I'm just inspecting your face. I'm looking to see if it's symmetrical. Looks symmetrical to me. I'm going to look in your hair. I'm just looking for any like lumps or lesions or anything that shouldn't be in your scalp. Everything seems to be well. I'm going to feel your scalp for symmetry. Your head feels nice and symmetrical. Are you having any tenderness or pain?
Mm-mm.
No? Alrighty. I'm going to feel for your occipital lymph nodes. I'm going to feel for your postauricular lymph nodes. Your preauricular lymph nodes. Your submandibular lymph nodes. Your submental lymph nodes. Next, I'm going to go to your cervical chain lymph nodes. I'm going to have you bring your shoulders together. And I'm feeling your supraclavicular lymph nodes. I didn't feel any. They were non-palpable. If they were palpable, I'd be concerned about some kind of infection going on, but I'm not concerned with that. Next, I'm just going to give you a little pinch on your clavicle here. I'm just looking for tenting of your skin trigger, but it went right back down. If it stayed up, I'd be concerned about your dehydration. So now that I've done your scalp, I'm going to move on to your eyes. So I'm just looking at your eyes. I'm going to have you look up, look down, look up, look down. Your sclera is nice and pink, and your conjunctive is nice, or your sclera is white, sorry, and your conjunctive is pink, and they look hydrated, so I'm not concerned about your eyes there. Next, I'm just going to do a few tests on your eyes. I'm going to be testing your cranial nerves 3, 4, and 6. I'm just going to have you look at my nose here. I'm going to shine a light in your eyes. Okay. Perfect. Next, I'm going to have you follow my pen light with just your eyes and try not to move your head. Perfect. That was your 6 cardinal fields of gaze. Next, I'm gonna just point this pen light at your nose. I'm testing your corneal light reflex. Okay, your reflection is symmetrical on your eyes, so no concerns there. Now that I've done your eyes, I'm gonna move on to your nose. I'm just gonna have you tilt your head back. Looking at your nose and looking at your nasal mucosa, making sure it's good, pink, and hydrated. I was also noting if you had any polyps, which I didn't see any, and a deviated septum, which I didn't see any. Next, I'm gonna have you occlude one nostril. Can you breathe in? Perfect. Can you occlude the other nostril? Breathe in. Did you have any issues breathing in?
Mm-hmm.
No? Perfect. Next, I'm going to have you close your eyes. I'm going to have you tell me what you smell.
Coffee.
Perfect. That was testing cranial nerve number 1, your olfactory, which seems to be working well. Next, I'm going to move on to your eye, or your mouth. Your mouth looks symmetrical. If it was unsymmetrical, I'd be worried about maybe like some stroke symptoms, but I'm not worried about that. Next, I'm going to have you clench your jaw. Perfect. Can you blow? Perfect. Next, I'm going to have you close your eyes. I'm going to do some sensation testing on your face. Just tell me when you feel something.
I feel it. I feel it. I feel it. I feel it.
Perfect. That was testing like the jaw clenching and this, and then the sensation was testing your cranial nerves number 5 and 7. Next, I'm going to have you open up your mouth for me. I'm just looking for any cavities, chippings, anything abnormal. Perfect. Next, can you smile? Your teeth look nice. Can I have you pull your lip down? I'm just looking at your oral mucosa, which seems nice, pink, and hydrated. Next, I'm going to have you stick your tongue out for me. I'm going to say ah. Perfect. Your uvula was moving upward, which is good. That was testing your cranial nerves number 9 and 10. Next, I'm going to have you stick your tongue out. And I'm going to head. Perfect. That was testing cranial nerve number 12. Now that I've done that, I'm going to look at your ears. I'm noting any redness or like swelling. I don't see any. I see you have piercings. Did you have any issues with that process of healing? Okay, I'm going to look in your ears. Looking for any earwax buildup. If I had an otoscope, I would use that, but I don't have one on me. Next, I'm going to just palpate your ears. I'm just like feeling for maybe like scar tissue buildup or just something abnormal. Your ears feel nice and good. Next that I've done your face, I'm just going to look at your neck. Your color looks good. Temperature looks good. Looking at your trachea, making sure it's aligned. Can I have you swallow? Okay, your trachea is nice and aligned. Next, I'm going to feel your carotid pulse. Somewhere. There it is. Okay. Carotid. Perfect. Next, I'm going to listen with my bell of the stethoscope, and I'm going to try and see if I hear any whooshing sounds. That would indicate a bruit, but hopefully we don't want to hear that. No bruits noted. No bruits noted. If I heard a bruit, I would be concerned about like an aneurysm or some kind of occlusion in that artery, but I'm not concerned about that. So now that I've done your eyes and your nose and your mouth and your ears, I'm going to have you turn around for me without standing up. Do you want your hair clipped?
Yes, please.
So as you're putting up your hair, I'm just kind of inspecting your back. I see you have a few moles here. Your color looks good. Temperature's good. I'm gonna feel displace your trachea, and I'm gonna have you swallow for me. I'm just trying and feel your thyroid. Perfect. You swallow again. Perfect. I didn't feel any goiters. If I did, I'd be concerned about a thyroid issue. So next, I'm going to put my hands on the lower part of your chest. I'm going to feel for your chest expansion. I'm just going to have you take a deep breath in and a deep breath out. Okay. So your my hands moved up symmetrically, which is a good sign. And then your AP diameter was a 2-to-1 ratio, which is also good. Next, I'm going to listen to 12 different spots on your lungs in a half moon-like fashion. Your lungs about here. Have you had any issues with your spine? Your spine feels nice and aligned. So next, I'm going to listen with the diaphragm of my stethoscope. This is her left side, this is her right side. Did you have any issues with your tattoo healing?
Nope.
No? Okay. So I'm going to start here and just take a deep breath whenever I place my stethoscope.
Mm-hmm.
Do you need to break it off?
Nope.
Okay. So your lungs don't sound nice and clear. If I heard any like crackles or wheezing, I would be concerned about like COPD or pneumonia. Next, I'm going to do what's called percussing. I'm just going to do some tapping on your back. I'm trying to get to the base a little more. Okay, yeah. So I was listening for what's called resonance. It's what you want to hear on your lungs. If I heard like any kind of dullness or not resonance, I would be concerned about fluid in your lungs. And I was trying to feel the base down lower because a lot of times like fluid would want to sit low in your chest, in your lungs. So now that I've finished with your chest, I'm going to have you lay down. You can take your clip out if you would like. And take your pillow away from me for a second. I'm going to have you turn your head to one side. I'm just noting any jugular vein distension. You can turn your head to the other side. I don't see any present. If I did, I would raise your bed 30 to 45 degrees. And I would expect it to go away, but if it didn't, I'd be concerned about some fluid overload. So next we're going to move on to your chest. Do you mind if I pull your gown down a little bit?
Mm-mm.
So I'm just inspecting your chest. I see you have some freckles. Your color looks good. Your temperature is good. So I'm just going to be listening to 5 different spots on your lungs, or on your chest. I'm going to be listening for the heartbeat of your heart, and then also noting if you have any murmurs. So this is her right side, and then this is her left side. I'm going to start off with using the diaphragm of my stethoscope, and then I'm going to be switching to the bell to listen for murmurs. So we're going to start with your clavicle. Here's your sternum. So your clavicle, space, rib 1, actually, clavicle, space, yeah, rib 1, space. That doesn't feel right. Clavicle, space, there we go, rib 1, space, rib 2, space. So this is your aortic valve. Lub dub was noted. Switching to my bell. No murmurs were noted. So next I'm going to go to your left side here, and I'm going to listen for your pulmonic valve. So you've got your clavicle, space, rib 1, clavicle, space, rib 1, there we go, space, rib 2, space. So this is your pulmonic valve. Lub dub noted. No murmurs noted. So this is your intercostal space 2. This is your rib 3, intercostal space 3. This is your Erb's point. This is your loudest point. Lub dub noted. And then listening for murmurs. No murmurs noted. So that's your intercostal 3. Okay, so we got your rib 4, space. So this is your tricuspid. Lub dub is noted. Try not to expose you. No murmurs noted. Perfect. So now I'm gonna try and find your mitral valve. So you got your clavicle, space, rib 1, space, rib 2, space, rib 3, space, rib 4, space, rib 5, rib 4, space. Keep losing count. Clavicle, space, rib 1, space, rib 2, space, rib 3, space, rib 4, space, rib 5, space. So I'm going to meet you at subclavicular. Meet it right about here. This is your mitral valve. This is your most accurate pulse, your apical pulse. Lub dub noted, and I'm gonna listen for a full minute. Okay, listening for murmurs. Okay, no murmurs were noted. Your apical pulse I got 70 beats per minute, which is good. It's within that range. So now that we've done your chest, we can cover your head up. We're going to move on to your abdomen. I'm going to start off by inspecting your abdomen. I'm going to pull your shorts down just a little bit. Okay, so I'm inspecting your abdomen. I see you have some moles. Your color looks good. Your temperatures feel good. I'm going to look from the side to look at your aortic pulse. Pulsating. I'm going to come to the edge of the bed to look for symmetry and see if you have any edema. Your abdomen looks symmetrical to me. So I'm going to start off by listening to some bowel sounds. So this is her right side, this is her left side. I'm going to start with the right lower quadrant and move in this direction. I'm going to listen with the diaphragm of my stethoscope. I'm going to start in your right lower quadrant. Your right upper quadrant. Your left upper quadrant. You got a lot of gurgles. Your left lower quadrant. Okay. You sound hungry because your stomach is like moving a lot. So I heard a lot of gurgles, which is good. That means your stomach and your bowels continuing well. Next, I'm going to listen to 5 different spots for any bruits. I'm listening to your aortic artery and your renal and your iliac arteries. I'm using the bell of my stethoscope to listen for those bruits. So I'm finding your sternum, your belly button. This is your aortic. No bruits noted. No bruits noted in the renals. Move to your iliac artery. Okay, no bruits were noted in those arteries, which is a good sign. Like I said, we don't want an aneurysm or any kind of occlusion in those arteries. Next, I'm gonna do the percussing, like the tapping on your lungs that I did. So, I'm gonna just go back in these quadrants. That's good. I heard what's called tympany, which is a good sound, because if I heard like dull, I would be concerned of some kind of mass in your abdomen. Next, I'm gonna percuss your right side, and I'm gonna be listening for the border of your liver. Okay, so right there is dull, so that would be the border of your liver. Next, I'm just gonna do some feeling on your stomach. I'm gonna start with superficial, and then I'm gonna go into deeper feeling. Let me know if you have any kind of tenderness or pain. Any tenderness or pain?
Mm-mm.
A little bit. Any tenderness or pain?
Nope.
Okay. So next I'm gonna move on to your femoral pulses. I'm gonna just feel how strong they are. Okay, I feel her femoral pulse right here. Next I'm gonna come to this one. Feel her femoral pulse right here. And then I'm gonna feel for symmetry. They feel nice and symmetrical. So next I'm gonna listen for any bruits in those arteries as well. I'm gonna listen with the bell of my stethoscope. I'm just gonna find them again. Okay. Listening right here. Listening right here. Okay. I didn't hear any whooshing, so no bruits noted there. Next, you're going to pull your gown down. I'm moving on to your legs. I'm just doing some inspecting. I see you have a tattoo. Any trouble with that healing?
Mm-mm.
I see your freckles. Your color looks good. Temperature looks good. Feeling for some muscle symmetry. Muscles feel good. I'm going to feel for your popliteal pulse. Those feel nice and symmetrical. I'm going to feel for your posterior tibialis pulse. Those feel nice and symmetrical. And then next I'm going to feel your dorsalis medius pulses. Those are nice and symmetrical. I see you have nail polish on, but I'm testing for cap refill. That's within 3 seconds. Okay, I'm not concerned about any perfusion, lack of perfusion down to your feet. So next I'm going to do a sensation test. Just like the face, but I'm going to have you, so this is sharp, this is dull. So just tell me if it's sharp or dull with your eyes closed and then where.
Sharp on my right thigh. Sharp on my left thigh. Dull on my right shin. Dull on my left shin. Sharp on the bottom of my right foot. Sharp on the bottom of my left foot. Dull on the top of my right foot. And dull on the top of my left foot.
Okay, so you got all of them right, which is good. If you got like 3 wrong or more, I'd be concerned about some neuropathy loss or just some kind of numbness in your feet. So next I'm going to have you sit up for me. So I'm just going to do some range of motions. Can you push up on my feet, on my hands? Perfect. Can you push down? Can you push up? Can you push out? Can you push in? Can you do circles? Okay, your legs range of motion seem to be doing well. I'm going to check your patellar reflex. Loosen it up. You might have a lack of one.
I don't think I'm hanging off the bed very much.
Here, step forward a little bit. Perfect. Your feet dangling.
Yeah.
Okay, now we'll do it. There we go. Perfect. So that reflex is working well. Next, I'm gonna get your shoes. Yeah, you can stand up. Did you feel dizzy at all?
No.
Okay. So I'm going to count to 10. I'm just going to have you stand with your eyes closed. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So I would give you a negative Romberg test because you didn't have any swaying. If you did, I would be concerned about your cranial nerve number 8 because that's your like balance. Cranial nerve number 8 is also your hearing, and you're able to follow commands, so I'm not concerned about your hearing. Next, I'm just going to have you walk to the edge of the room. Perfect. And then can you walk back heel to toe? Perfect. Your gait is well, so I'm not concerned about any of that issues. And then the heel to toe is also testing your cerebellum function, which seems to be working right. You can have a seat if you would like. Finally, and also when I was testing your eyes, I noted that they're perla, so their pupils are equal round, reactive to light, and accommodating, so that was good. Next, I would give this patient a 23 on the Braden scale because she doesn't have any issues with mobility. Her diet's good, her nutrition's good. She has no continence issues. She's not in any kind of pain. Her skin integrity is good, so I'm not concerned about any risk for pressure ulcers. Thank you for allowing me to do this assessment.